Hi, my name is Andrew Woods, and I'm an inpatient physical medicine and rehabilitation consultant with UofL Health. Becoming a physician for me was a really personal journey. My grandfather, when I was growing up, was never in great health, but he had some bad experiences with doctors when he was younger. And so whenever I would ask him to go to the doctor, he would always say, I'll wait for you to become a doctor first. And so that was my inspiration, because I felt like if I could make a good impression on people as a physician, they wouldn't have that same fear that my grandfather had and might be in better health as they went along. My job is to really make sure that patients and families are well educated about all of the opportunities that are available to them after discharge. So one of the things that we help guide a lot of our stroke patients and spinal cord injury and brain injury patients is, can you go straight home, or do you need a little bit of extra rehab before that? And so talking to the patient and their families about what does your home look like and trying to assess their needs before they go home is really at the crux of my job, while at the same time helping the inpatient teams with some of the neuro recovery aspects of their injuries to ensure that we're getting the fastest and strongest recovery possible in the time that they're in the hospital. My approach to patient care is really trying to meet the patient and their families where they are. Our primary patient population at Frazier is going to be strokes and brain injuries and spinal cord injuries, and so those come with unique challenges. And so making sure that I don't try to create a perfect world for the patient, but create their perfect world and ensure that we're meeting their needs is my ultimate goal as their physician. Frazier is the #1 rehab hospital in Kentucky and a top rehab hospital in the whole country. And so what really sets us apart is our team-based approach. So when you're meeting me in the hospital on the acute inpatient side, I have a whole army of people behind me that are going to take care of you at Frazier and really kind of help put back the pieces of life that have been interrupted. And so I think that's what really sets us apart, is that the rehab team doesn't start with me in the hospital and it doesn't end with our physicians at Frazier, but it really encompasses the entire continuum of care, both from the inpatient side, the rehab side, and then as outpatient as well. So when I'm not at work, I have young kids and a wife, and so you'll usually find us exploring some of the new parks or playgrounds in Louisville. We love Kentucky Kingdom and the zoo and all the fun family-friendly activities, so that's usually where most of my free time will go. I'm also an aspiringly bad golfer, so if I do have some extra time, I try to get in a round of golf here and there.